This is an educational presentation on bucket handle meniscus tears. The meniscus is a crescent-shaped tissue composed of fibrocartilage of type 1, and it's located between the femoral condyles and tibial plateau. The anterior and posterior horns are attached to the tibial plateau via roots. The fundamental part of normal knee mechanics is that the meniscus protects and cushions the joint surfaces. There is, however, limited blood supply to the meniscus, and it's divided into three zones: the red and the red-white and the white zone. The red zone is the outer third, it's vascular. The red-white is pink middle third, and the white zone is avascular inner third. Medial tears are the most common overall. There is an unhappy triad, and that involves an ACL tear, an MCL tear, and a lateral meniscus tear. And the pattern of the tear is based on the size and location. There is a vertical longitudinal tear, a bucket handle, an oblique tear, a degenerative tear, and also a transverse or radial type tear. This picture here on the right shows a bucket handle tear. Patient history examination is crucial. Usually there's a rotational force or twisting knee injury while playing sports. There's varus or valgus stress on a flexed knee. There's medial lateral joint pain and tenderness, which is localized to the joint line. There's swelling and mechanical symptoms such as locking or clicking. Oftentimes the patient cannot straighten or bend their knee fully. The workup includes standard knee radiographs to rule out fractures. Usually it's normal in most patients with meniscus tear. MRI is most sensitive to evaluate meniscus, ACL, and other surrounding soft tissues. Here on the MRI you can see on the left side a meniscus tear from the red arrow with a fragment flipped in the notch. You can see on the sagittal view that there's a tear in that posterior horn of the meniscus. Non-surgical treatment involves healing, which depends on the location of the tear. The peripheral one-third vascular red zone has a greater chance of healing than the inner third. Pain and swelling are usually managed with physical therapy and anti-inflammatory medications, and this is the initial treatment modality for most degenerative tears. Surgical treatment involves an arthroscopic procedure to debride or repair the torn meniscus. A torn meniscus is a partial medial or lateral meniscectomy, and the meniscus repair is shown on the right here. There are better surgical outcomes with minimal or no osteoarthritis in the patient, and the indications for meniscus repair are red zone tears, vertical longitudinal tears between 1 to 4 centimeters, and repair associated with concurrent ACL reconstruction. Here is a video of a posterior horn partial bucket handle tear of a lateral meniscus. This tear is in the white zone and therefore will be removed. I am clipping off the torn fragment and taking a shaver to then debride the remnant. The reason that this tear is removed is because it is in the non-vascular white zone and it will not heal and will re-tear, and the patient will need a second surgery to remove the torn part. You can see there's ample remnant meniscus. Postsurgical care involves soft dressing and compressive leg wrap after surgery. For a partial meniscectomy, you can bear weight after the surgery. There is no running or other high-impact activities for 4 weeks. For a meniscus repair, it's non-weight bearing for 4 weeks.